The Norwegian government has signed an agreement with the World Health Organization worth 8 billion shillings to improve COVID-19 vaccine coverage and its rollout in the country.
It has given 80 billion Ugandan shillings, which comes to about 20 million Norwegian krona, or over $2.4 million. This will, of course, our need is far more bigger than this, but for the vaccines we are going to have next week, which is also supported by Norway's dose sharing, and the one which follows with the another batch which we expect would be from other dose sharing, which would be about another 1 million doses. This funding will make sure that that reaches the public in time.
And let me also mention, since we are here today, that probably next week, Norway is also providing 285,600 additional vaccines through the COVAX cooperation to Uganda.
According to the agreement, World Health Organization will work with the Ministry of Health for the specified project time of 12 months.
And to date, only 17.5 of these vulnerable people have been vaccinated. However, many of you will also realize that with this second wave, the pattern of vulnerability changed, and many of the youthful people under 40 years of age have been infected, and many have succumbed to the virus as well, meaning that everybody in Uganda, at least above 18 years, needs to get vaccinated.
Dr. Cheng says that there are many molecules of COVID-19 vaccines on the market.
Zeneca, both Covishield and the Vaxzevria, Johnson & Johnson, Pfizer, Moderna, Sputnik Light, Sputnik, Sinovac, Sinopharm. Those are some of the vaccines that we can have in Uganda. The World Health Organization has only recommended the mixing of AstraZeneca and Pfizer. The others, research is still ongoing. However, because we need to vaccinate the population, whatever vaccine we get, we shall bring it in.
The minister also said that Uganda National Medical Stores has the capacity to store vaccines at very low temperatures like Pfizer and Moderna.
Capacity to store vaccines at very low temperatures. Vaccines like Moderna, like Pfizer, can be stored. We don't have that capacity in the districts, but it doesn't mean we cannot use the vaccines. When the vaccines come in and at the national medical stores, we can carry out outreaches. Move out, vaccinate people, 2, 3, 5 days, bring the vaccines back to national medical stores if they are not used up. Geographically, map out the areas and say if this area here is going to receive Pfizer, then we know the group of people. And then another area can receive another one, so that we avoid mixing, because research has not yet given us all that evidence except for AstraZeneca and Pfizer. But because we need to vaccinate, we are not going to say no to any vaccine that is available. Because right now, there is a high global demand. And we also need to vaccinate our people and open up the economy. So if we are rigid in accepting what is available, then we will not meet our targets of vaccinating them.
The Minister of Health re-echoed the challenge of African countries accessing COVID-19 vaccines, citing global demand.
The challenge is that there is a high global demand for vaccination, and the production does not meet the demand. And therefore it is extremely difficult to access vaccines, even when you have the money. And so I continue to appeal to Her Excellency, even when you have contributed, you also need to help us pursue and get access to the vaccines.
The country rolled out the COVID-19 vaccination in all 146 districts, municipalities including cities, on March 10, 2021. Overall goal is to prevent, reduce severe COVID-19 diseases and deaths. Zahara Abigaba, UBC News.